So this video is for patients of Abbey Dental to help with your home professional whitening. So the first thing you're going to want to do is take your whitening gel. There's usually a tip on it, you just remove that off. And if you press on the syringe plunger, you should see that a small amount comes out like that. Okay. The next thing you want to do is get your whitening trays. Typically you'll have one upper and one lower. What you want to do is orientate your whitening tray so that the inside is facing up. And if you have a look, it's like it's making a small kind of N shape, the letter N. So the inside is facing up and it's making a small N shape. And if you have a look, what the idea is, in the very far surface of the tooth where you can see this black dot, you want to put a dot the size of a matchstick head. So it will look like that and like that. If I get closer so you can see how that looks. I've skipped the back tooth here. It's not necessary to do the back tooth because often you can't see that far back, but the idea is you would do that everywhere. And again, the size is the size of a matchstick head. You don't need to use more, you'll just end up wasting the product. So once you've put a blob of whitening gel the size of a matchstick head in this area, kind of in the middle of the tooth, on all of them, all the way around, I then want you to set your tray to the side. And say these were your teeth, you would then brush your teeth as you've been shown. Ideally, before you've done any whitening, you'll have come to see the hygienist because that will get rid of any plaque and calculus and staining so that the whitening really absorbs. So hopefully you would have had your teeth cleaned, and if there's any areas of improvement that you need to make with your own brushing and flossing, she would often go through that with you. So after you've loaded your trays, you brush your teeth. I then want you to take a tissue and just roughly, this is not an exact science, dry the front of the teeth like this, okay? You will then take your tray and pop it in. Okay, so if you have a look, the gel is actually now on the front of the tooth. Okay, so you just press it here. All the way around, press it on a tooth. If you've used the correct amount of gel, you shouldn't have loads of gel seeping out everywhere. If you do, that means you've used too much, if it's going on your gums and going everywhere. If any does come out of the tray or seep out, then just take a tissue and kind of wipe it off, okay? Most people that do home professional whitening will be doing this at the night time, so then you sleep in at night with this, and when you wake up in the morning, you'll take the tray out and you'll give the tray a brush with some toothpaste and a toothbrush and rinse it out with water and leave it to dry so that you can do this the next night, okay? If you're doing home professional whitening and you're doing the nighttime version, typically you will have two gels. Two of them will say 10% and the other two will say 16%. So what we would like you to do is use the 10% first, so use the 2 tubes of 10% and then use the 2 tubes of 16%. Some people have a preference for a certain percentage, so if you've specified you only want 10 or only want 16, that might be what you have. But for most people it's 210 and 216. The rough amount of time that this course lasts is about 2 weeks, but it depends how you are with dispensing the product. Some people are a bit more heavy-handed, so as long as you get to the 10-day mark, then that's absolutely fine. And some people are a bit more light-handed, so it might last them slightly longer than the 2 weeks. If you're not doing the nighttime whitening, you'll have different gels that say 6%. It's exactly the same technique. The only difference is instead of wearing the tray in the nighttime, I want you to wear it in the daytime for 2 hours. The other thing I want you to bear in mind is these gels do need to be kept in the fridge. So the best thing to do is just pull the plunger back, and that way the gel will kind of go back in. You see it's gone back in slightly, and then keep it in the fridge. And that will keep the active ingredients nice and fresh, okay? You need to do this every day for 2 weeks to get the best results. If you really want maximum results as well, we advise avoiding any staining foods or drinks during the course of the treatment. So to give you an idea, anything that would stain a white t-shirt, tea, coffee, tomato sauce, those sorts of things. Having said that, if you can't do that with your diet, this treatment will still work, so please don't worry. So I hope that's been clear, and we will also send you written instructions which explain the entire procedure.